Hello, I'm Ian Scales, you're watching TelecomTV, and we're here at the Internet of Healthcare event, and I'm talking to João Bocas, who is digital health influencer and entrepreneur. João, thanks very much for coming to TelecomTV.
My pleasure, Ian.
Okay, tell me a little bit about yourself and your background and your company.
Okay, so I have a company called Digital Salutem, and we work with innovative companies in the digital health space, and what we do, we represent innovative companies in digital health, Internet of Things, wearable technologies, in big data, and help them to penetrate new markets.
Right.
But about myself, I've been in health and wellness for over 20 years. I was actually a sports coach and a fitness coach for a number of years. I worked with professional football clubs and with many clients, and then I entered the digital healthcare scene by accident, if you like, because I actually started a startup with a business partner, and then we evolved from there, and I've been involved in global health, digital health, healthcare for quite a number of years now, which is very, very exciting.
And you were in place to watch the whole thing really take off, weren't you?
Yeah, I would say, especially in the last 3 years, there's been really a revelation and a bit of a revolution. Things are really moving and evolving all the time.
I was going to ask you a sort of framing question about this whole area. Today we've been here at this event and we've been listening to lots of speakers and so on talking about it. How do you see, what is the difference between traditional medical technology and Internet of Things style technology? What separates the two?
Well, I believe the Internet of Things gives us now a new dimension to use the connectivity capabilities that perhaps in the past they were not there, and now the Internet of place and the Internet of people, if you like, help to bring that all together. We are connected naturally with our computers, our mobile phones, games, devices, wearables, you name it. Is this just a natural modern society thing now? And then healthcare is just a progression from there, and is a natural fit, I believe. But in terms of separating the two, I believe that is actually a progression instead of a separation, if you like.
I understand, yes, that makes sense. So it's about data really, is what you're saying. It's about the ability to feed data back?
Yeah, I came up, when I was preparing one of my talks on Internet of Things, I came up with actually an innovative approach for IoT, Internet of Things, which I believe can be called Internet of Transaction.
Right.
Because when we talk about data, we're talking about engaging people with healthcare solutions, for example, is a transaction. We transaction the data for perhaps an intervention. And if we talk about, for example, bringing wearables to the equation, wearables that they generate data. So you're very right there, it's actually about data.
About feeding back. Okay, and what are some of the most interesting developments that you're watching at the moment? We were talking about wearables before, and I suppose things like watches are coming up, becoming much more capability. Where do you see some of the big things of the future happening?
Well, now we have really several verticals, if you like, associated with healthcare. We have artificial intelligence, augmented reality, but lately I've been noticing a really new trend within the wearables, if you like, because when the wearables came out, it was about tracking steps, and that was very innovative back then. Back in 2011, Fitbit released the first fitness tracker, and that was a big deal. Now, I believe if you just offer me a steps counter capability, it's not a very exciting proposition. But all this to say that biosensors now are the new, can be the new big thing in healthcare, because they can actually read body chemistries and be with us at all times. So with small implants, small wearables, and having sensors, they can actually feed the data but be with the human being analyzing the body, and I believe that is quite a breakthrough revelation in that sense.
So that's the next big and up and coming thing, and that will enable us to see conditions developing rather than people turning up at hospital once the condition is actually fully formed.
Yes, and also continuing monitoring the person, just instead of intervening when a disease is actually developed. If we have that capability of having a 24/7 reading,
Yes.
health reading map, if you like,
Yes.
we can monitor things and assess things and intervene early, if you like.
Now, obviously, there's a huge industry existing already around medicine, and there are large bureaucracies like the National Health Service and so on. What are the main roadblocks to these technologies being deployed effectively on the national scene? What's holding things back?
Well, that's a big. That's
It is
actually
a big question,
It's
yes.
a big question. I'm going to come up with a couple of barriers which I believe they probably be in front of the adoption. The adoption rate is not moving at the same rate of the innovation is. So the innovation is moving really fast. Now we have biosensors can go in our bodies, but the adoption for some reason is not quite there. And also accessing the data, it continues to be a problem because the data it comes from different places, so is decentralized and very fragmented, but also our services in healthcare and the interventions are very fragmented, so we go to different places for different things. I believe that constitutes actually a problem, and when we is a complexity in healthcare, and I believe when we bring more things into the equation, instead of solving a problem, we can actually by default bring more complexity, because healthcare is actually complex in the first place. So what I would like to say is try to solve existing methodologies and systems and bureaucracies that perhaps don't help move forward before we can adopt a revolution or a technology or a solution, and make sure it's a straightforward fit and a natural fit instead of being another problematic approach or a
Yes.
problematic delaying
Yes.
adoption in the first place.
So are you talking about sort of taking small steps that you know are going to work and then moving on to the next stage?
Yeah, and also erasing barriers as they are, because even before we adopt, for example, a solution, there are barriers in place, whether that are existing care models that don't work, or the healthcare system is not fit for purpose, whatever that is, or the technologies actually don't work together, whatever that is, we need to erase those barriers before we can actually try to bring something else into the equation.
So that's a huge problem, isn't it? I mean, you're talking about, again, something really quite vast. I suppose, what are the mechanisms, do you think, to enable you to enable us all to kind of get to those problems? We don't seem to have the right structure at the moment to actually start untying it all and working out what we should do. What needs to change in terms of structure so that we can actually bring these changes in?
Go back and stop and thinking about existing complex systems and approaches that they probably too conservative, and they are approaches of the past, if you
Right.
like. Simplify things, because healthcare actually is a very simple thing. It's about looking after oneself with healthy behaviors, whatever that is, in walking more, exercise more, eating more, and eating more efficiently and
Yes.
better, and sleep more. So whatever that is. So simplifying healthcare is actually a huge challenge, and also educate people that healthcare is not actually a complex thing. We just make it complex because we human beings, we create problems and complexes and processes.
Yes.
That's what we do.
Okay, so what about people who can move things along? Do you think there's scope for new actors in this area? Like we think about hospitals at the moment and the existing medical structures. I'm thinking of you bringing all this new technology, and maybe there's room for other types of company to become involved. Say, social media companies, for instance, who can act as a focus for people exchanging information. Do you think can you see that changing too? Bringing in new types of business model, new types of sharing structures?
Yeah, absolutely. I would say playing with each one's strengths is actually a very good possibility with communication tools, because healthcare is also about communication and exchanging the data or exchanging messaging or even interventions.
Yes.
So I believe that other types, non-traditional healthcare providers or companies or businesses can come to the equation and bring something else from a different angle, a different proposition that it will eventually help those already in the system.
João, thank you very much. That's very interesting. Thank you.
Thank you, Ian.